It's natural for us as surgeons to be intimidated by the idea of AI coming and telling us how to do surgery. And one of the things about being a great surgeon is your confidence that you already know the right thing to do. But there's no question that having a great Copilot and team around you, which all could be this AI watching everything and helping you, can make you better. We talk about standardization. Joint replacement surgery is one of those ones. The more standardized, probably the better. But every surgery should be custom. You should literally, for brain surgery, not do the same thing every time. The question of how to customize, though, is driven by experience. You can't have that, not everyone can have that experience. You can use the AI to help you to do that part. So it's going to watch everything. You're going to be operating, and you're going to start to see injection into the picture of augmented or mixed reality, where it starts to say, okay, that red zone is where you are going to have problems if you keep going. So even if there's tumor there, you may not want to go there because you don't want the deficit. But the next thing it may do is actually provide you haptic feedback. An example of that would be a suction, which is wired. The tip of the suction is stimulating. That's hooked up to a brain interface. And when I get close to a critical structure, it detects those fibers, which I know if I go through them, it'll be devastating. And it will start to tell you, beep, beep, beep. My advice is that when a wave is coming, it's much better to surf the wave than to fight the wave. Nobody can fight the wave. It's completely different than the old days. So I think really getting nimble at learning how to stay ahead and to adapt to the new tools is going to be critical.